Hello, practical nursing students. My name is Darlene Lepresto and I'm one of your nursing instructors. And this video today will show you how to perform an intramuscular injection and a Z-track injection. I have all my supplies here. So first we're going to do hand hygiene. We would have already been down and assessed our client, made sure that they were all right, and let them know that we are getting their medications prepared and we'll be back shortly. Now first I'm going to show you how to open what's called an ampule. An ampule is a glass vial that we use that certain medications aren't compatible with other types of vials like plastic or silicone, so they have to come in glass. So we do still use these even though they seem a little archaic. We still have to use them. The nice thing about these is they're quick and easy, I think, and no air bubbles. So I'm just tapping it to make sure that all the fluid goes into the bottom of the vial. Now these vials are perforated, or they have a line drawn in them in the glass so that when we break this open it helps it to break nice, clean and evenly. But the thing we have to worry about is some micro glass particles may end up in our medication. So what we need with this is an alcohol pad. We need the appropriate size syringe with a needle, appropriate needle, and we need what's called a filtered needle. And this filtered needle will help filter out any of the glass particles that may end up in our medication. So again, hand hygiene. I'm going to put on my gloves. And I'm going to show you a regular injection with this medication from the ampule. Okay. Now there's several ways that you can open this. You can use a 2x2, you can use an alcohol swab, which is what I'm using, or some of the hospitals now have a little plastic guard, and we've ordered some, that go down over it, and you can just snap them off that way. So today we're going to use an alcohol swab. And usually what I do is I kind of clean around the edge of it, just because, germaphobe. And I'm going to let that dry for a minute, and I'm going to get my syringe ready. Now remember, when you're handling syringes, the barrels of these and the tips are sterile. So we don't want to break that sterility. So I'm going to leave the needle in there because I'm going to use that in a minute. I'm going to take this out. The tip is sterile. We're going to open the filtered needle. So those two are sterile. It's a lure lock. You just take it and screw it on. And we're all set. Hopefully I didn't put it on so tight I can't get it off. Alright, we're ready to break the ampule. Now when you break the ampule, you are breaking it away from you. So wrap the alcohol swab around it. Don't aim it at anybody, and just with your thumb put some pressure, break it away. It will snap right off again because that's perforated, and immediately get rid of the glass. You have your filtered needle. This one's a long needle, it's a big one because it's got a filter in it. Now the thing about these ampules, it's really cool. When you turn them upside down, they're not going to leak all over the place. It's really cool. I'm going to put my needle in there. Need my glasses. See? It doesn't come out. So slowly you're going to withdraw. Now the trick again is you have to keep your needle sterile, and I have to keep my plunger sterile, which I'm not doing a very good job of, because my needle is so long. And it's bubbling up just a little bit, but I'm keeping the bevel of the needle right down way in the bottom of that fluid so I can get every little bit that's in there. And you can always enter it again if you have to. I'm going to throw it away. And just tap out some of the bubbles as you're pushing the air out. And this is going to be 2 mLs. And my plunger is right at 2 mLs. Alright? Now, I'm not going to inject my patient with this filtered needle because it might have some of the glass particles in it. So I'm going to scoop. I'm going to get my sterile needle out. Again, not touching the hub. I'm going to remove the filtered needle And I'm going to immediately put the clean needle on, or the appropriate needle on. Let's get rid of our filtered needle. And now we're ready to go inject our client. Has a safety cap on it. So let's get our pretend client here. Again, we've identified him. We've checked our medication sheet so we know exactly what medicine we're giving, what it's supposed to do, what side effects we're supposed to look for. With this injection, we start right in the center of where we're going to give the injection and circle out with friction. Allow it to dry. That's what kills the bugs. Friction, alcohol, and allowing it to dry. And we'll be asking you, while you're doing this, we'll be asking you some different questions about the technique or about the medication. And it's not to scare you or alarm you, it's to help you learn. All right, we're ready to give the injection. We've identified him, no known allergies, he's the appropriate patient. Now you have to choose which site. So you could do ventral gluteal, you could do the deltoid if it's 1 ml or less, you could do vastus lateralis, rectus femoris, but of course we don't do dorsal gluteal anymore. So be sure that you take a look at those and that you know and are able to identify those different sites, because you will be asked those. All right, here we go, we're ready. Now this has a safety mechanism on it for when we're all done, which is nice. So a regular intramuscular, the skin remains flat, and we just put some gentle pressure. You just don't want some sliding around. You don't want the skin to move away from the needle when you're injecting. Again, bevel up because that'll help the needle go in easier. You want it to glide in. We're going to go straight in, and then we're going to slowly inject the medication because it might hurt, and then we're going to withdraw. So 1, 2, 3. Your book talks about a two-step or two-handed where you let go and you can hang on to the syringe. So you can do that if you want or not. Just be sure you control the syringe and you're not doing this. That hurts. Right, we're all done. Some medications you have to wait a couple of seconds, 3 to 5 seconds, just to make sure it distributes throughout the muscle, and then you withdraw. Engage the safety mechanism with your thumb, if this is the type of syringe you're using, and then get rid of it. Now you are allowed to massage the area for intramuscular if you want. That does help the medication distribute, and it helps some of the pain. The next procedure I'm going to show you is a Z-track, and we would not want to do that with the Z-track. So let's go right into the Z-track. I'm going to take my gloves off, and I'm just going to draw up some medication. So hand hygiene again. I'm just going to draw up a little bit of medication just to show you the method of the Z-track, and you are supposed to be thinking about the why of the Z-track. So it's in your book, and if we were together I would be asking you the why. So why do we do it? We give it with vitamin B12 because that stains the skin. We give it with some other medications to make sure that it stays down within the muscle and doesn't leak out. So I'm drawing up air. I'm giving 2 mLs. So I'm drawing up the air, 2 mLs. I'm going to inject 2 mLs. We're always replacing the fluid with air. It just helps the negative pressure in the vial. And then we're going to withdraw. I'm touching the plunger, which I'm not supposed to. It's so hard to do. All right. So I overdrew a little bit because this is saline, and I'm going to just tap out my bubbles. All right. And I have 2 ml. Okay. All right. Now, with Z-track, the purpose of Z-track is to take the subcutaneous tissue and move it off to the side so that you can inject more into the muscle, and then when you let go, the subcutaneous tissue slides back over the muscle, and it causes a barrier at the puncture site so the medicine can't leak back out. So be sure that you take a look at that in your book. There's a really good picture in your textbook about Z-track. So I'm going to clean one more time. And you know what? I need to put my gloves on without touching that needle, so we should not be doing this. That's a bad habit. I didn't have to used to wear gloves when I was a nurse. All right, Z-track. So I'm going to start and I'm going to push over, pushing that subcutaneous tissue over, and then 1, 2, 3, 90-degree angle directly in. Nice, slow, steady administration. Give it just a couple seconds. Withdraw, engage the needle safety, allow the subcutaneous tissue to go back over, and I would just observe for a minute to make sure it doesn't leak. Do not massage a Z-track method, because you'll ruin why we're doing it Z-track. And then, of course, we remove our gloves one more time, hand hygiene one more time, and all your exit procedures with your patient. Thank you.